If you or someone you care about is requiring insulin injections to manage their diabetes, super important to keep one thing in mind. I had a patient who's in his mid-50s, and when he initially came in to see me, he was using insulin injections for 3 to 4 years with his regular team. And the first thing that I do when we discuss diabetes medications with a patient, I'm Dr. Sabrina Haq, I'm an endocrinologist, is I try to assess whether the insulin dose makes sense for the kind of patient that someone is. So in his case, he was 5'9", he is 5'9", and he lives in a 200-pound body. And for someone of that kind of body frame or that kind of type, even if it's type 2 diabetes, requiring 160 units of insulin a day and having poor blood sugars does not make sense, because that's way too much of an insulin dose. So I took a look at the places where he was injecting insulin, and this was really bad type of insulin skin complication known as a lipohypertrophy. And this happens when injections are being injected into the same area over and over again. Super important to know that when someone is taking insulin injections, you always want to change the site of injection. So for example, if you're injecting in the fatty area at the back of your arm, you want to inject your next dose at least an inch or a couple of inches away from that area, just to give that site room to heal, to get better. Also important to make sure that before you inject insulin into that area that you're feeling around, just to make sure that there are no lumpy, bumpy tissues on that area. So insulin should be injected into any type of subcutaneous fatty tissue. So we don't want to inject insulin directly into an area where there's very little subcutaneous fat. So not in your biceps area. We want it in the back of your hand. We want it in your tummy. For this patient, when I took a look at his insulin site injections, he was injecting into his lower abdomen over and over again. And both sides of his lower abdomen had very discolored, fatty, hard, scarred tissue. And this kind of complication is something that's easy to identify when you take a look at it, if you know that you need to look for it. And people who have this kind of skin type of complication because of frequent insulin injections into the same area, they end up needing higher and higher insulin doses without having blood sugars controlled, because the insulin does not even get into the body to work. So the insulin just stays in the scar tissue. That's why someone's insulin doses keep requiring adjusting higher and higher. So especially nowadays, because healthcare can get so rushed, or maybe you're just getting, or someone you care about is just getting tele visits or virtual visits, super important to keep in mind that if you or someone you care about is requiring higher and higher insulin doses when previously they did not, or